All right, so the clavicle portion, we've got the body, we've got the sternal extremity. So the sternal extremity of the clavicle is the piece that attaches to the manubrium of the sternum. You've got your acromial extremity, which is the end that attaches to the acromioclavicular joint. The acromioclavicular joint attaches to the acromion on the scapula right here, and then this is the coracoid process right there. So the sternal end attaches to the manubrium, forming the sternoclavicular joint. And then they're showing you the jugular notch here. So as we talked about earlier, when you are including everything on the image, that you want to include the inferior angle of the scapula to about half or a little more of the manubrium to pick up the spinal column, and then the outside of this shoulder. So that would show your collimation to include everything within that shoulder. The internal external rotation is what you would want to include. So for a clavicle, if you're collimating for a clavicle, you're going to central ray on the body of the clavicle, and then you're just going to collimate to get the clavicle, so you're not going to have to include as much of the shoulder. So the larger box is for the shoulder, the smaller box is your collimation for your clavicle. So the clavicle, it is a long bone, and it has a double curvature. And if you look back here, you can see that it turns this way, and then it also turns this way. So from the middle of the shaft, the body, you've got two curves, one to pick up the manubrium and the other one to join and pick up the acromion. Size and shape difference between the males and females. So a female is shorter and less curved, and then the male is thicker and more curved, and it's usually most curved in heavily muscled men. So the more muscle they have, the more curve you're going to see in that clavicle. So anatomy review right here, we've got A, which is the acromion. We've got D, which is your acromion extremity. C, which is the body. B, which is the sternal end. And then A, which is the sternoclavicular joint. So A, sternoclavicular joint. B is the sternal extremity. C is the body and shaft, and then D is your acromial extremity, which is the extremity end of the clavicle, and then E is your acromioclavicular joint. You've got three borders on the scapula, so we're back to talking about the scapula now. So you've got three ends, or three borders right here. You've got the superior border right here, which is here. So superior border, medial border, or the vertebral border. So your medial border or your vertebral border, because it's closest to the vertebral bodies right here. You've got your lateral or the axillary. So the lateral border right here, which is close to the axillary portion. So your axilla is right here. So that's why it's that axilla border, okay? And then this is the inferior angle, and you have your superior angle up here. And you can see all of this labeled out here. The next slide is going to show you what these labels are. So you have your acromion, which is here. You've got B is the neck of the scapula, and we'll get to that in just a little bit on the next one. So you've got the neck of the scapula. You've got C, which is your scapular notch right there. You've got D, which is the superior angle. You've got E, which is your vertebral border, medial border right there. F, the inferior angle there. You've got G, which is your lateral angle. Axilla angle, axillary border, and then H, which is your glenoid cavity, right in there. Okay. Let me see. I think I skipped a couple of slides because I went to 14 from 10. Let's back this up a little bit. So here's an anterior view of your scapula. This is your scapular notch. You can see that right there. Your superior angle. The body, what they're calling the body, can also be called the blade, the wing, or the ala. And if you remember the ala from your pelvis, so this is the ala. The costal surface, which is anterior. So the reason it's the costal surface is because your ribs lie on top of this. So this portion here is looking at the ribs. So that's the costal surface, the subscapular fossa. Your inferior angle, right here you have the neck of the scapula. So it's coming from the body and the ala to the neck, and then you have your glenoid cavity, the glenoid fossa. You have the lateral angle of the head right here. So you have the suprasternal notch here, and then you have a lateral angle of the head. Okay? Your acromion process right there, and then your coracoid process right there. So the scapula, this is the posterior view. This is the view if you were looking at the back of the person, so PA to AP. So this side is PA, and this side here is AP. So the AP portion is going to be going to have the ala on it. The PA portion is not going to have the ala on it. So on the PA portion, you have the supraspinous fossa. So the supraspinous fossa, so superior. And then you have the dorsal surface, which is posterior. So the dorsal surface right here. And then you have the infraspinous fossa. And those are just above and below the crest or the spine of the scapula. So with your spine, with the spine of the scapula, the crest of the spine, you have a supraspinous fossa and you have an infraspinous fossa. Here's your acromion that curves out to the front, and then down here is your coracoid process. So as you're looking at your AP scapula, the anatomy here, as I said, I'm sorry I jumped ahead, so we'll just go right over here to the next one, and I've already explained it as well. So it gives you the list, so you're going to be able to identify and understand where each one of these is pointing to. So your Scap Y, your lateral scapula. For the Scap Y, there are different ways to do it. You can do it either AP or PA. So this one is showing you PA. Whichever way works for you is what you're going to use. Neither one of them is wrong if you do it AP or PA, just as long as you get everything in the image that you're looking for. So as you can see, this one here is cutting off a little bit of the inferior angle. So C is your inferior angle. E is your is the body of the scapula, okay? So the entire body of the scapula. And it's creating this Y right here, and that's why we call it the scapular Y. We want it separated from the ribs, so your ribs are running here. So when you turn that patient and you're getting this scap Y, you want to make sure that they're turned enough that the ribs are separated from that scapula. So D happens to be the spine of the scapula. A is the acromion. B is the coracoid. And then you've got C as your inferior angle down here. And this is a really good scap Y. It's separated from the ribs. It's making that, that unique Y right there. So that would be an ultimate picture, except for clipping off that inferior angle. So your scap Y, this is just showing you which each one of these is, what they're named, where they're located, and what they'll look like on an optimal scap Y view. So B, your coracoid process right there. So that's B. You've got A, which is your acromion. Right there is A. Sorry, that's a bad looking A, but that is A. Let me do this. So A is your acromion right there. The spine of the scapula right here is what D is talking about. So D is the spine of the scapula. E is the body of the scapula, and you can see this right here, which is all the borders. So you've got your ventral, your costal surface. So this right here is that costal surface because it's against the ribs. This is your dorsal surface because that's on the posterior aspect. And then you've got your, it's saying lateral axillary border, which it is, but we call this, which is going to be E, is going to be the body of the scapula, okay? So that's the body. And then C, in this image, we're seeing that it's clipped off, but C is actually the inferior angle of the scapula. All right. So this is a unique projection. So inferior, superior of the shoulder. It's inferior because we're coming in inferior and we're exiting superior. Okay. So this patient is laying supine. The angle is coming inferior to superior. You've got a little bit of an angle on this. This tube head, this image receptor is pushed in as far as it can into the neck. So you want to make sure that you push it in as far as you can. And then your angle is going to be right in the axilla of that image receptor. And then this is what you're going to end up with. So D is your, should be your acromion. This is your glenoid cavity. This should be your neck or your spine, and then this should be your coracoid right there. We'll go to the next image to see what we've done. So A is the coracoid like we talked about. So A is the coracoid. B is the glenoid cavity, which is right here. You can see that, see the way that cavity is coming in there. C is the spine of the scapula, so the spine right there. And then D is the acromion, which makes this look right here. Okay? So, Scap Y view, we already talked about that. It's just another refresher as far as being able to name everything, but the scapula view, the lateral view of the scapula. Joints of the shoulder girdle. We have Of course, the sternoclavicular joint, which is right here, which is the clavicle to the manubrium, the sternoclavicular joint. The acromion clavicular joint, which is the clavicle and the acromion, the AC joint. You have your scapulohumeral joint, glenohumeral or shoulder joint, which is right here. So any of those will do for naming it. So scapulohumeral, glenohumeral, or the shoulder joint for those joints there. Movement types. Once again, this is just committing to memory. So they have the joint, and we had 3 of them. So the scapulohumeral, the sternoclavicular, and the acromioclavicular. You've got the movement type. So the scapulohumeral joint is spheroidal or the ball and socket. It's a greater freedom of movement. So this one reminds you of the hip socket, which is also a ball and socket joint. The sternoclavicular is a planar gliding, along with the acromioclavicular, which is planar gliding. So you really only have to remember 2 because these 2 are the same, plane and gliding. So it's just the scapulohumeral, which is a spheroidal ball and socket type. So a little bit of a quiz me here. You can follow along. So which of the following humeral structures is most distal? So is it the anatomic neck that's most distal, greater tubercle, lesser tubercle, or the surgical neck? And it would be the surgical neck that is most distal. And the way to think about that is you've got your humeral head, okay? And then we know that from the head, you have your greater, I didn't draw that very well, but you have your greater tubercle, you have your intertrabecular groove, you have your lesser tubercle, and then you have your surgical neck, which is here because the anatomical neck is right there. Okay? So what is another term for the mid area of the costal surface of the scapula? So the mid area of the costal surface, so the costal surface is closest to the ribs. So subscapular fossa, if you remember that, that's on the PA portion. Okay. The infraspinous fossa, that's also on the PA aspect of the scapula. Supraspinous fossa, scapulohumeral surface. So let's see here. And I was wrong. So what is another term of the mid area of the costal surface? Oh, you're right, subscapular fossa. Supraspinous. This is on the PA. This is on the PA. This one is on the AP. And then the scapulohumeral surface is more of a lateral more lateral than AP or PA, so it's not on the costal surface. So the subscapular fossa is what we use to determine the area, which is the mid area on the scapula closest to the costal surface. Which of the following scapular structures is most posterior? So we're looking for posterior, which is most PA on the scapula. So coracoid process, if we look at the scapula and we remember the scapula, so the coracoid process points anterior. The glenoid cavity is basically a lateral. So the coracoid process is anterior. Anterior. The scapular notch is superior. And the acromion, if you remember, it comes off and then comes around. So that would be most posterior part of the scapula. Okay? So what is the joint classification of the scapulohumeral joint? Okay, so if we think about the scapulohumeral joint, would it be tricotial? Would it be a plane? Would it be bicondylar? Or would it be spheroidal? And if we remember back to the chart, it's spheroidal. It's a ball and socket. So we have basically the socket, and then we have the head of the humerus that fits into there. So that would be a spheroidal ball and socket type of joint.